Quote of the year is, when you are dead, you do not know that you are dead. All of the pain is felt by the others. The same thing happens when you are stupid. You are going to give the pain to the others, and you do not know that you are giving the pain to others. So, coming to the diagnosis of the calcaneus spur, history and the physical examination, and the other is imaging. So, first, the history and physical examination. Spur outgrowth can be detected as a hook of the bone protruding from the foot. It's the point where plantar fascia is attached to the heel bone. And in the clinical examination, lower extremity functional scale LEFS range of the motion limited in the ankle and the foot are also noted, especially passive dorsiflexion of the toes and the palpation of the proximal plantar fascia attachment at the heel is also examined. Now, any tenderness, sight, or the severity of the deformities can be felt in combination with dorsiflexion. Any atrophy of the heel pad comparing with the other foot with reduced muscle strength, any swelling, any skin tear on the foot, any difference in the foot alignment comparing with the other foot, aggravation on weight bearing, evaluation of the gait and the sensation, presence of the hyposthesia and dysthesia of the tibial nerve that is called tinal sign that is noted for the sensation. And here one can see when the flexor hallucis longus, that is, if you just make the foot like this, and there will be the triangle will be larger, and here one can see the big toe is lying flat on the ground. But here, if you just lift the foot, and there is the shorter triangle, so one can see the plantar aponeurosis that is larger in this case and it is shorter in this case as it is shown by the triangles. Now, the other tests are the heel rise or mini squat test, which why the pain increases if the weight bearing on the heel, as you can see, the heel rise, there will be decrease in pain and the stretch on the fascia will be decreased, so there will be decreased pain. And in case of the mini squat, that is also the weight bearing is less on this calcaneus, and that is also going to cause the pain that is decreased because of the mini squat. Now, the second part of the diagnosis is imaging. A heel spur diagnosis is confirmed by lateral foot x-ray that show calcaneus spur formation or calcification at either insertion of the Achilles tendon or origin of the plantar fascia. A heel spur can extend forward a half an inch away forward from the calcaneus bone without visible X-ray evidence. The condition is called heel spur syndrome. Rarely MRI is required to confirm the diagnosis. So here one can see the calcaneus spur on the X-rays, that is out projection from the, and here is also, and here is the calcaneus heel spur on MRI. One can see the heel spur, the bony projection, and here also one can see the bony projection coming out from the calcaneus bone. Now, the differential diagnoses are as chronic heel pain mimics with many conditions, diagnostic imaging and the medical signs are used to exclude the different diseases, and the musculoskeletal causes are peroneal tendonitis. It is the inflammation of the one or the both peroneal tendons, and use MRI scan or the ultrasound to rule out the calcaneus heel spur. The next differential diagnosis is Haglund's deformity with or without bursitis, symptomatic osseous posterior superior prominence of the calcaneus bone, radiograph or the sonography of the foot in the maximum dorsiflexion can exclude the calcaneus spur. So here one can see the healthy foot, and here there is peroneal tendonitis. As one can see, the peroneal tendon, when it is passing near the heel, it is inflamed and it gives the feeling like the heel spur. So that is the peroneal tendonitis. And here in case of the Haglund's deformity, one can see the bone prominence and the bursa, and this bone prominence that gives the feeling of calcaneus heel spur, but basically it is just the bursa which is inflamed and the bone prominence which is called Haglund's deformity. Now the continuing differential diagnosis, Sever's disease, it is the calcaneal apophysitis, inflammation of the calcaneus apophysis due to the overloading. Clinical ultrasound investigation can rule out. Then the traumatic influences that also mimic the calcanean heel spur. Number one is calcaneus fracture and stress fracture due to the repetitive load to the heel, Ottawa ankle rules, radiography, MRI, isotopic bone scan, and ultrasound are the modalities to differentiate from the calcaneus spur. And here one can see the calcaneal apophysitis, Sever's disease. There is inflammation of the growth plate of the calcaneal bone, and here is the Achilles tendon, and there is the heel bone calcaneus. So there is inflammation of the growth plate of the limb, which is called Sever's disease. Here one can see clearly the fracture of the calcaneal bone, and that is the displaced fracture of the bone, that there is a gap and two parts of the calcaneus bones are displaced, so called displaced fracture. The other causes are, in the differential diagnosis, neurological causes. That is number one, Baxter nerve entrapment, chronic compression of the first branch of the lateral plantar nerve, and that is also giving the pain like the calcaneal heel spur, and clinically there is tunnel sign to rule out. Now, tarsal tunnel syndrome, sinus tarsi, impingement of the posterior tibial nerve. It's just like the carpal tunnel syndrome in the wrist. So the clinically tunnel sign, dorsiflexion aversion test, and the others that can rule out that. Heel fat pad syndrome, atrophy or the inflammation of the shock absorbing fatty pad or the corpus adiposum. Again, clinically an ultrasound scan can differentiate. Then fourth neurological cause is chronic lateral ankle pain with other causes, and that is MRI which can rule it out. So here one can see the Baxter nerve, the first branch of the lateral plantar nerve that is trapped. And here one can see like the carpal tunnel syndrome, the tarsal tunnel in which this nerve is trapped, and when the pressure on this nerve is there is pain and inflammation here. And here it is the inflammation of the heel pad. One can see the heel pad that is normally heel pad fat, and here there is no fat, and that is also going to cause the pain. Then other common causes of the ankle pain are bone bruise, arthritis, and the bone break, which are responsible giving the pain, mimicking like the calcaneal heel spur. That is wonderful photography, and it is showing that the kid is just holding the moon in his hand, and it is really the wonderful photography. Now, coming to the treatment, it is mainly three parts of the treatment. Number one, pharmacological treatment. Number two, non surgical treatment. And number three is the surgical treatment. First, we are going to cover the pharmacological treatment. As the name is pharmacological, it means there are certain medicine are used to just give relief to the pain. Heel pain may respond to over-the-counter anti-inflammatory medication one can have from the medical store like acetaminophen, ibuprofen, or naproxen. Corticosteroid injection relieve inflammation in the area for 1 month. Side effects include the peripheral nerve injury, plantar fascia rupture, and the post-injection flare. So you have to keep in mind while giving the corticosteroid injection. The other part of the treatment is non-surgical treatment, that is conservative treatment, lifestyle modification, foot and calf workout, strong muscles in the calves and the lower legs will help. Icing the area will immediately cause the pain relief. Physical therapy also help. Shoe recommendations, proper fitting shoes, and footwear modification. The things which are used in the shoes are insoles. Patient with the heel pain diagnosed as the Sever's injury wore insoles. Significant pain reduction seen during physical activity. Taping or strapping to rest the stressed muscles and the tendon will also relieve the pain. So here one can see the icing the part of the heel that is going to give the proper relief. Footwear modification according to your feet and the heel that will also help. Then one can use the insoles which can give relief to the heel spur and heel bone, and there is a taping to give rest to the muscles and tendons and the fascia. So that is also part of the treatment. Continuing the non-surgical treatment, shoe inserts or orthotic devices. A functional orthotic device can correct the cause of the heel and the arch pain, such as the biomechanical imbalance, pronation, and inward movement of the foot. Only relevant when calcaneus spur is related to plantar fasciitis. Orthotics reduce rear foot peak forces on both sides. Then heel inserts or heel spur pads. These relieve the heel spur pressure and the inflammation, and they catch shock forces and distribute them evenly throughout the heel, reducing stress, not reduce the rear foot pressure and increased rear foot peak forces. And here one can see the orthotic devices that is just going to give relief to the heel area, as one can see. Then these are the heel inserts that also make comfort the heel and the plantar fascia and the pain because of the heel spur. And continuing non-surgical treatment, foot logics provide relief from the plantar fasciitis heel pain and heel spurs, Achilles tendinopathy, and forefoot pain. Aim is to correct the overpronation, fallen arches, and flat feet. Night sprints that keeps the ankle in 5 degree of the dorsiflexion for 8 weeks also help. That gives significant relief of the heel pain. Then sometime the laser therapy and the dry needling, that is also giving relief to that. So here is the foot logics that can be used, and that is the night splints which are applied to give rest to the area and the muscle. And here one can see the dry needling as it is being used in the plantar fasciitis. And here is the laser therapy, the cold laser that is given to the part affected of the calcaneus bone, and that is also going to reduce the inflammation and ultimately the pain. Now, the third part of the treatment is surgical treatment. 90% of the patient get better with non-surgical treatments. If conservative treatment fails after 9 to 12 months, then surgery necessary to relieve pain and restore the mobility. Surgical techniques include release of the plantar fascia, removal of a spur. Complications are nerve pain, recurrent heel pain, permanent numbness of the area, infection, and scarring after the surgery. Risk of instability, foot cramps, stress fracture, and tendinitis are there. So here one can see the surgery. We open the heel and heel spur that is removed surgically, and that is going to give the permanent relief from the pain which it is causing by causing the plantar fasciitis. Now, different type of the shoes which are being used, but the aim is just to give cushion to the calcaneus bone and calcanean heel spur so that it is not going to hurt by touching the ground. And if there will be a cushion between the heel spur and the ground, there will be the less injury to the plantar fascia and causing the pain of plantar fascia. These are the different kind of the shoes which are available, and one can opt for which one do like. Now, how to prevent the heel spur? That is, wearing the well-fitting shoes with shock-absorbent soles, then rigid shanks and sportive heel counters, choosing the appropriate shoes for the each physical activity, warming up and doing stretching exercises before each activity, and avoid wearing the shoes with excessive wear on the heels and the soles. And if overweight, losing the weight will definitely help to prevent the heel spur. So that was all about the calcaneus heel spur. I hope you may have liked this. If you like this, just please subscribe my channel. And if you have any question or query, please talk to me. I have tried to give as much as possible about the heel spur. And still, if any question, you can ask me. And thank you very much to be with me and sparing your time and just watching this. Thank you.